You're watching WKBN 27 First News, where your news comes first in high definition.
Cancer is always an ugly word. Today we're talking about skin cancer with Dr. Michael Sevilla from Salem Community Hospital. How common is skin cancer?
Well, skin cancer is the most common cancer that's out there. And the most recent statistics that we have is every year about 60,000 people are diagnosed with it, and 10,000 of those die every year. And, you know, even in the summertime, you know, I still see, you know, a lot of cases of it and sunburn, and people still need to be educated and know about skin cancer.
Who is most at risk of a skin type or whatever?
Most commonly it is you know, the fair-skinned people, and the older people are also at risk for it. We also see it a lot in people, especially teenagers, that do a lot of you know, the indoor tanning, and that's a big risk factor for skin cancer.
Let's talk about some of the common, simple steps for preventing skin cancer.
Yeah, especially for kids, you know, to stay inside or stay out of the shade from 10 to 4, using suntan lotion, SPF 15 and higher, and to keep covered, you know, wear a hat, sunglasses, that type of thing.
This could also lead to other problems on a more immediate scale for like dehydration and things like that, right? If they're out in the sun too long?
Yeah, exactly. And you've seen in the past month or so when we had the really hot temperatures, so we worry about sunburn, skin cancer, dehydration. Those are the fairly common summer type things that happen.
Dr. Sevilla, one of the things you look for is melanoma or something on type of the skin, right? And you've boiled it down to A, B, C, and D. Go through that for me and what you're looking for when you see a spot on somebody's skin.
Yeah, melanoma is the most deadly form of skin cancer, and how we break it down is you know, asymmetries. Does the spot look the same all around? Border is, you know, does it have a jagged border or a smooth border? If it's jagged, then it's a problem. Color is it a uniform color, or is there spots on it? If it's spots on it, that's a risk factor. A diameter, usually if it is the size of a eraser head on a pencil, and evolving, meaning if it's changing over the past few days or a few weeks, those are definitely signs to get it checked out by your doctor.
Immediately, correct?
Absolutely.
What about for a sunburn? Some people will say, hey, I'm just going to rub some lotion on it and stay home. When should they seek immediate attention for a severe sunburn? Well,
pain is a big thing. What we worry about not only with the sunburn, but is also there is a secondary infection that can start. If you start to have drainage, pus, pain, that could mean the need for antibiotics or even looking for skin cancer as well.
All right, it's fun to be out in the sun this time of year, but definitely be careful. You don't want to go overboard and have it develop into skin cancer.
That's right.
Dr. Michael Sevilla from Salem Community Hospital, thanks for being here. If you have any questions, you can call the hospital 332-1551. First News at 5. We'll be right back.